Welcome to our webinar titled MDS Patient Panel. Thank you so much for joining us today. We're delighted that everyone can be here with us. My name is Lee Clark, Director of Patient Services, and I'll be moderating the webinar today. As we get started, I'd like to recognize the generous support of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting the webinar today. This webinar is an interactive patient panel, and there will not be any medical experts here today to be answering any specific medical questions, but our patients are joining us today to tell their stories and to help with answering some of your questions and sharing their experiences. And hopefully you'll find this webinar very helpful as you and your family move throughout your journey with MDS. I'd like to let you know about a few of our upcoming programs, which you may also find helpful. First, next Saturday, we'll be hosting our next Patient and Family Conference. The conference is in conjunction with all 3 Mayo clinics. We will be hosting sessions in person and virtual from Jacksonville, from Phoenix, and Rochester. Registration is still open, so please take some time to register for that upcoming conference. And we're also going to be hosting a conference shortly, which will be in October the 14th. Which will be in New Haven, Connecticut, and then on November the 4th, which will be in Dallas, Texas. Our last upcoming walk, our March for Marrow, will be on October the 1st, and that will be in the Virginia, in the DC metropolitan area. It's our last walk for 2024. Please, if you can't attend in person and join us, there is a virtual option that you can show your support for everyone diagnosed with bone marrow failure diseases. Next, I'd like to just go over a little bit about how you can submit your questions for the panel today. So, if you're looking at the engagement panel, if you look to your right, you'll see that there's a Q&A button. Just open up that button, type in your questions, hit enter, and the questions will come to us, and we'll be filtering through them one by one for our panelists to be able to answer all of your questions. I'd like to remind you again that this is not a panel where we have medical experts, so please don't be asking medical questions. Our panelists will not be able to answer those questions for you today. So thank you so much, and we're going to go ahead and start with our panelist. Great, thank you so much. So today on our panel, we have Donna, Janice, and Tim. So thank you all so much for joining us. And we'll go ahead and get started with you all just giving a little introduction about yourselves. Tim, would you like to get started?
Yeah, sure. My name's Tim. I live in St. Louis, Missouri. I was diagnosed with MDS about 2.5 years ago. And after going through a couple different doctors, I found a specialist that was really helpful for me. It took a little time. I'm also have a condition called hemochromatosis. So the two diseases are very challenging because I cannot have a phlebotomy and I cannot have a transfusion. So normal treatment for both blood diseases cancel out the other. So it's stressful, and I'm walking a fine line as to managing how I do. So.
Thank you, Tim. Janice, would you like to go next? Janice, you're on mute. Oops. There you go.
Sorry. This thing keeps switching back and forth.
It's
Anyway,
okay.
I live in the San Francisco Bay Area in California. Was diagnosed with ET about 6.5 years ago. My platelets were 2 million. And after a bone marrow biopsy, they diagnosed me with MDS 5Q. And so I have the same problem as you do, Tim. I don't know if you require transfusions. I've had about 25, and I have hemochromatosis too. So
Really?
you don't know what to do because you can't have a phlebotomy, and you
Right.
can't, and I need transfusions because my hemoglobin goes down to 6 sometimes. But I feel fine even at hemoglobin of 6. I know that's really bad, but what can you do? My doctor wants me to take Vidasa. I took Revlimid and it failed on me. It helped for 10 months and then it didn't work. So I don't know. What are you taking Vidasa, Tim? Or
I'm taking it. Maybe what you said doesn't work. I'm taking luspatercept, but it's got another name. Do you know what it is? Is that? Anyway,
Reblozo.
Mhm.
yeah. So
I
keep
took
hearing,
that too and it didn't work.
yeah, it's working okay for me, but it sounds like all these drugs have a born on date where they stop working. So
Yes.
I'm okay now, and I'm managing the hemochromatosis with an very, very rigid, low, no iron diet, which
Oh
also
no.
has its own problems because I also cannot take chelation medicine.
Right.
I feel for you. They want me to take X-Jade and people say they get really, really sick on it. It ruins your liver.
Yeah.
So I don't know. I mean, everything you take has you got to weigh the benefit versus side effect.
Right.
We're
It's very stressful.
Yes.
Let's let Donna give a little introduction and then we'll get into a little more of this if that's okay with everyone. Oh,
Yes.
here we
Go,
go.
Donna.
Donna, go ahead.
Sorry.
No, thanks, Janice.
Thank you. I am Donna Gilbride. I live in Ohio. And let's see, I was diagnosed on February 24th, 2012. I have been very fortunate. I found my way up to Dr. Sekeres up at the Cleveland Clinic. And through him, I was on Aranesp and yes. And then I went to the trial study of luspatercept, which was approved by the FDA and is now Reblozyl. I have been on Reblozyl / luspatercept since March of 2017.
Wow.
Wow. Very fortunate that my body responds. The biggest thing that I would like to say, and yes, you're right, Jim. Every drug does have, I guess you want to say, an end date where your body just stops responding. And when that day comes, I will definitely go on another trial study. I'm a firm believer in trial studies because you still get the standard of care. You just get an extra drug and you are so well taken care of by your docs. You see them probably more often than if you had not been on this trial study. And, to me, going on luspatercept was such a no-brainer. The side effects align directly with MDS. And that I was living with every day anyway. So I am just kind of going along now and doing well. But what is well when you have MDS? It's kind of funny because with the three of us, the blessing with MDS, you never look sick. You just don't.
Right.
So it's really, so when I put my handicap plaque in my car, because I'm having days where I just am so short of breath. I am so winded. I have no energy. And it's really profound at that time. I park in a handicapped space and people look at me like, what? Come on, lady, you're losing. No, I'm not. I just don't look sick. But yeah, I am a very strong proponent of the trial studies because I feel that's the only way we will ever come to a cure. Will I see it in my lifetime? No. But by gosh, I want to add to that research.
Thanks, Donna. We do have a question. The question for the panel is, what did your doctors tell you your diagnosis was after they told you you have MDS? How did they explain MDS to you? Janice, do you want to take that one first?
Oh, after the bone marrow biopsy, they did the NGS, the next generation sequencing on me, and discovered I had the MDS with 5Q, which is a rarer form of MDS. And that's why I couldn't respond to luspatercept as Donna did. I'm so envious of you. I didn't have, I did Aranesp, all those things, but nothing. Luspatercept didn't work at all on me. My hemoglobin went down to 6 again. And I was still feeling fine. I went and played 30 holes of golf 2 times a week with a 6 hemoglobin. And then, they were giving me transfusions. That's how I got the hemochromatosis like Tim. And we're kind of stuck. We're darned if we do and darned if we don't, right, Tim?
Yeah, it appears that way.
Yeah.
Tim, what did your team tell you MDS was?
This is an interesting story. The first hematologist I went to at a major hospital here, I went in for elevated iron. I got the bone marrow biopsy. I went back to his office, and after a hardly intelligible description, which I didn't understand, I left and I was out paying my bill, and he came out and handed me a piece of paper and said, "This is what you have, read it." And
Wow.
so I fired him. And then I went to another hematologist who was had a lot of empathy, gave me the time and sat down and explained what I have, and gave me I can't remember the chart that gives you your longevity if it's untreated, but of course there's no chart that gives you your longevity if it is treated. So then you're put into the stressful situation of how long do I have? But that's how it got going with me.
Thanks, Tim. Donna, how about you? What were you told is your MDS?
It was a nightmare. I went to a community hematologist, oncologist, and she told me I had an uncurable illness, Myelodysplastic Syndrome. I was to go home, read everything on the internet, come back in 2 weeks, and she would answer the questions. And oh, by the way, you have 3 to 5 years.
Wow.
I was stunned. You're stunned by the diagnosis, and then you're stunned by the way you're being treated. Within about 3 months, I found my way up to the Cleveland Clinic to Dr. Sekareth. We talked in depth the first time about MDS. And it was interesting. He said, "Did your doctor tell you this is a red blood cell cancer?" I said, No, I would just go home and read. So it was a nightmare until I got to Dr. Sekaras, and he didn't leave unturned. He makes sure you understand absolutely everything he's talking about. He speaks in layman terms as well as medical, because he wants you to be able to formulate the questions you need to live with us.
Great.
And now I'm with Dr. Caraway,
Oh, great.
because Dr. Sekaras left and went to Florida to a lovely, lovely facility down there.
Thanks, Donna. Our next question from the panel is, at what point in your disease was it determined that you needed to begin treatment? What were your symptoms and disease progression? Janice, you want to take that one first?
Well, when I first was diagnosed on a routine blood test, with platelets of 2 million, they sent me right to a hematologist, and she was very dismissive of me. She said, "Okay, dear." She talked to me like I was 5, like an idiot. And she said, "I'm going to give you these little pills, and you just take a little pill every day, and it'll knock those nasty platelets down." And so I went to, not knowing any better, because she didn't seem like it was any big deal. I went to the pharmacy and they said, "Okay, this is chemo." It was Hydrea. And I said, "Chemo?" She didn't say anything about chemo. I had no idea. And when you read the blurb, it says, don't touch it with your hands. You got to wear gloves, and they expect you to swallow it. So I was really freaked out. And I said, so then I went and I got another hematologist at the cancer center in Berkeley, and he's very good. His name is Rajesh Bell. And he said, "Oh, that other hematologist is an idiot. We're going to do a bone marrow biopsy on you to see what's wrong with you." He said, "Your platelets are off the charts." And I was already anemic at that point, but I didn't know because I felt fine. I was already anemic. And so therein lies the problem. I don't know whether the first hematologist flunked out of medical school or what, but she was really bad. She was very condescending, treated me like a little kid. "Okay, dear, just take this." So I'm thankful that I'm now, and I also have a second opinion with a doctor at Stanford.
Good.
And he's very good too. He's an actually MDS specialist. His name is Dr. Peter Greenberg. He actually started he actually started with the Revlimid. He was in the studies, and he's 85, but he was instrumental in getting the Revlimid going for MDS with the 5q deletion. So
Thank
very
you.
nice guy. He's just really, really old, but he's really a nice guy.
Thanks, Janice. Tim, how about you? The question was, at what point in your disease was it determined that you needed to begin treatment? And what were your symptoms and disease progression?
Well, my iron condition was picked up on a routine physical. And that's where I went in then to see the specialist. As I described before, I changed specialists, and right away, after a bone marrow biopsy, he started me right away on treatment with Aranesp. And I frankly didn't have any symptoms of feeling bad or any. Actually, I felt great until I started the treatments, to be honest with you. And then it's sort of been like that after now I've changed to the other drug, Reblozyl. So,
Tim, did they start the Aranesp because of lab work numbers? Do you know why that was suggested for you?
Right. My hemoglobin was low.
Okay.
Yeah, it was down in low 7s, high 6s. So, but they couldn't believe I was like walking around, but it didn't feel bad.
Sure. Thanks, Tim. Donna, how about you?
It was probably 4 months, maybe 5, before I started on Aranesp. I had received a couple transfusions. My energy level was low, my hemoglobin was low, shortness of breath was pretty bad. But I have to say, I agree with Tim about Aranesp. I found it to be a roller coaster, and it was very hard physically to take it because you were constantly going from a high number and then you soared straight back down. It was just, that was my experience. And I should have said with Reblozyl, when I was on the trial study, this trial study initially was for people with ring sideroblasts. And it was really cool. About 2 months ago, about a month ago, FDA came out and gave permission for all MDS patients to be able to use this, because they're now finding that it's almost like and I hate to say miracle drug, but it's going to be a very important drug for MDS because it's combining it with other drugs. And it looks like they're getting some pretty good results with that. So they said Reblozyl is just at the tip of the iceberg. But it was not pleasant getting the transfusions, shortness of breath, totally exhausted. So that's how I started.
Thanks, Donna. Our next question is, have any of you experienced any symptoms while having treatment, and how have you managed those symptoms? Tim, I'll let you take that one first.
I guess the symptoms that I have are muscle weakness, tiredness, some shortness of breath. It's just one day I get up, I feel on top of the world. By 2 p.m. I don't, and then the next day it's something else. It's just a roller coaster. So it's hard to describe.
Janice, how about you? Have you experienced any symptoms with your treatment, and how have you managed those?
I suppose that I'm very sensitive to any kind of medication because I usually have GI symptoms like nausea, sometimes the runs, stomach pain, and it was really bad with the Hydrea. I was only taking one every other day, and I'm a very small person. I only weigh about 95 pounds, and I'm 5'2". So I don't know whether I was overdosed or what, but then with the Aranesp, the first injection I had, I fainted. And after that, I was okay, but it didn't help the blood at all. And then with the luspatercept, I had no side effects from it except the sore arm because that thing really hurts. But it didn't help the blood at all, my anemia. I don't have the ring sideroblast. So I think if you have those, it really works. Like you folks, Tim and Donna, I'm so envious of you because I tried that for like almost a year and it didn't work at all. So I never got shortness of breath, thank goodness. Never was tired. I mean, I could run around. I could still run and play golf 30 holes a day. Run up and down the 30 stairs in my house.
Mm-hmm.
I never had a problem with fatigue, but maybe, I don't know, I better knock on wood here. But I'm really happy for you two. I mean, that's wonderful. Wonderful news for you, for your anemia.
Oops. Hang on 1 minute. I lost Donna. Donna, I'm giving you a buzz back. Here we go. Sorry about that. And we'll let Donna help with that next question. There you go.
We are.
Okay, thanks, Donna. How about you? What kind of symptoms and how have you managed it?
My symptoms are shortness of breath,
Uh-oh.
pretty often. I then, when I went on luspatercept, I still have shortness of breath. I still am exhausted. I manage that by resting. I still have what I call MDS days, where the exhaustion, the shortness of breath is over top. But majority of my time, I'm able to handle both of those by resting in the afternoon. And if it's an MDS day, I'm just down for the day. It's just the way it is. It just kind of rears its head. I could be dressed and ready to go out with my husband somewhere, and this wall I've hit, and I just can't do it. My friends, my family, my husband are very supportive. I couldn't ask for any more help, and it's not so much help, it's the emotional support. Because unfortunately, I'm very independent. And I want to be able to do as much as I can, which I know my caregivers have a hard time with that, but they also appreciate my independence. But yeah, my biggest are those two. And I always say my daily, if you rate it on 1 to 10, I'm a 3 to 4 daily.
Thank you.
Exhaustion and shortness of breath.
Thank you. So our next question says, how often a month does Donna get luspatercept injections? And what are the after effects that you've had?
Oh, good question. I get 3 shots every 3 weeks. I have absolutely no after effect. As Janice has said, it is extremely painful if they push the shot too fast. So they're really nice. They do a very slow shot for me. But I have no side effects. Maybe it does add to my exhaustion. Maybe it does add to my shortness of breath. But I wouldn't know because I've just lived with it every day prior to luspatercept.
Thanks, Donna. Janice, do you want to talk about your experience with luspatercept again?
All I know is what Donna said. It's very painful to get the injections. I had mine every other week, and it takes forever because they have to reconstitute it from powder. So the pharmacy, I think they had a bunch of turtles or snails working there. It would take them like 2 hours to reconstitute it, and then I'd have the shot, and never had any side effects other than a sore arm for, it's kind of like getting a flu shot. But it's very disappointing because after almost 6, 8, 9 months, it was no effect on my anemia at all. I just kept going down, down, down. It never made it increase, never made my hemoglobin increase at all, ever. So, and it was very expensive. If I looked at the Medicare, it was something like $15,000 per shot. Did you folks see that on yours? $15,000 per injection that they charged Medicare, which was crazy.
I did not see that, Janice.
Do you have Medicare?
Yes, I do.
Well, I don't know whether my hospital, because I had it done in the hospital. And that's what they charged every time. But of course, Medicare only approved like 6,000 or whatever. And they paid it. They approved it and they paid it. Because there's no way I can afford things like that. $15,000 every other week. Come on.
Thanks,
Crazy.
Eunice. Our next question, Tim, this question is for you. It's regarding Aranesp. Was anything else tried in replace of the Aranesp, such as Procrit, or was Aranesp the only thing that you were offered?
It was the luspatercept was the one that was offered immediately, and I guess it was because of the obviously failure of what I was taking before. So they went right to that, and it started working. And my experience was on regimen was identical to Donna's, and still is. So.
Great, thank you. Janice, did you have experience with Aranesp, and did that
Yes.
work at all for you? Okay.
Yes, I had Aranesp before the luspatercept. Friend was on that for about 1.5 years, and that didn't work at all either. And I don't know, Tim and Donna, do you have the 5q deletion, or do you just have regular MDS? I think I have the crummy one.
Oops. Donna, hang on. Donna, 1 minute. I'm going to unmute you. Hang on 1 sec. Whoops. Okay, go ahead.
Yes, I do not have the 5q deletion, and I have ring sideroblast.
Lucky you.
I don't know. I don't know about the 5q deletion, but I have ring sideroblast.
See,
Okay.
that's why the luspatercept works for you. Darn.
Donna, this question is for you. It says, Donna, they'd like to know, why do you get 3 shots every 3 weeks? It says, is it because you need a higher dose? They'd like to know why you're receiving 3 shots, and they'd also like to know, when was your last blood transfusion? Oh, give me 1 minute, Donna. Oops. Go ahead.
Okay, I always had, let's see, I'm backing up. I used to get 2 shots. With luspatercept, let's start here. You start at a 1.0, and I forget dose. Then you go up to a 1.5 and then a 1.75. I am currently at the 1.75. When I reached the highest dose, they started giving me 3 shots. So I don't know if it has to do with weight as well as the dose that you know, whether it's the lowest or middle dose. That I'm not sure of. And there was another part to that. I'm sorry.
They'd like to know, when did you have your last blood transfusion?
Sure. My last blood transfusion was about 8 months ago.
Okay. Thank you. Tim and Janice, since you have both been, or Tim, you guys have used the ribosol, luspatercept. When was your last blood transfusions? Tim, you want to take that one?
Yeah, my last blood transfusion was, I think, about 9 or 10 months ago. And the reason for the 3 shots, by the way, is because of just volume, that they need to do it. And I did ask, just give me the max. And they said, well, it does depend on your weight. So weight is a factor on the dosage.
Great. Thank you for that, Tim. Janice, when was your last blood transfusion?
It was July 27th of this year. And prior to that, about 6 weeks prior, I had 2 units
Wow.
because my blood was down to about 6. And so I feel fine. I mean, other than, just getting cold sometimes, but I have no shortness of breath or fatigue at all. I never have in 6 years. So even with having no blood and platelets of 2 million, it's pretty bad. They can't, whatever they do to try to, reduce the platelets would also reduce the hemoglobin. That's why he's just leaving the platelets as they are. And I know that's terrible. I mean, I don't know anybody that has platelets of 2 million.
This is a question for all of you. The question is, have you had to have multiple bone marrow tests since your time of diagnosis? And Donna, I'll let you take that one first.
I had to have multiple. Specifically, when I was on the trial study, I now on post-trial study. When I was on trial study, I got bone marrow transplants every 6 months per study protocol.
Wow.
But once it was approved, I went on post-trial study, and they left that up to the doc. So my last bone marrow was about 3 months ago because we wanted to see what was going on. My hemoglobin was declining and it wasn't making sense, but it's stable. And that's it. That's what any MDS patient wants to hear. It's stable.
Thanks, Donna. Tim, how about you? Have you had multiple bone marrow biopsies?
No, just one. And after that, I didn't volunteer for others. So it was.
Absolutely. Janice, how about you?
I've had 2. One when I was first diagnosed with the ET, and one, let's see, I think it was 2021. So there are 2. And I agree with you, Tim. Those things really, really, really hurt.
Yeah.
Very, I mean, most of the people in the hospital say that they hear people screaming in the room when they do it. And I wasn't screaming, but I was hanging on to the nurse. I think my fingernails dug into her hand, almost become unconscious. And I was really sorry about that. But it is very painful in my opinion.
Thanks, Janice. Our next question, this is for all 3 of you. Did your team ever discuss with you about a bone marrow transplant? And Tim, I'll let you take that one first.
I asked my hematologist about that. I referred to it as the nuclear option. And he said, your chances of survival would be low because I have some other health issues going on. And I'm 78 years old. So it's off the table.
Thanks, Tim. Janice?
I don't think I'm a candidate. I have no relatives at all. Everyone's dead, and I'm really old too.
And
I'm too old.
I'm not old.
Oh, I'm sorry. You're just a young buck. And I'm old. I'm older than dirt.
And we'll let Donna take that one too. Go ahead, Donna.
I did talk about bone marrow transplant, and I just don't qualify. Yes, the outcome is not good for somebody, but actually for anyone. And they know that they can keep me alive longer than take the chance of even getting right up to the transplant, because I think around only 30% make it to transplant. That's how rough it is. And
Yes.
then I think another 30% only make it like 1 year. So it's really tough. But they've made so many improvements with bone marrow transplants. Your stem cell, it's a conversation that Dr. Fairway and I have, I told her I want to revisit. I know that she's not in favor of it at this point in time, but I want to educate myself on it just in case it might go on the table someday.
Thank you. Our next question, this is for all three of you. They'd like to know, since you've been on treatment, how has your hemoglobin been and what is it now, if you know? Janice, we'll let you take that one first.
Well, I just went in for blood work Tuesday, 2 days ago, and my hemoglobin is at 8. So, which is, my doctor said that's the borderline for transfusion. You're not eligible for transfusion until you're below 8. So he said, do you want one? And I said, no, my ferritin is off the charts. And so I'm just going to wait. I'm going to wait until it goes down to maybe 6 or 6.5 because of the ferritin. You know about the ferritin, right, Tim?
Very.
Yeah. So
that's what I live by.
You have had how many transfusions, Tim?
2.
Oh, that's all. Wow. I've had 25.
Well, that's part of the problem with getting more ferritin in you. So
I know.
Tim, how about you? How is your hemoglobin and do you know what it is today?
my hemoglobin on my last test a few weeks ago was 8.4. I've been in the 8s for a while. I went up to 9.1 once and had a party. And then I've been down below 7, and in the high 6s is when I got my 2 transfusions, when I got that low. So I'm kind of level, but I've never been up above. I've only been up really above 9 once, and it was brief.
Thanks, Tim. Donna, how about you?
My hemoglobin is currently at 9.4. However, now when I was on air nest, I would always stay in the 9s. Occasionally I'd hit 10. I'd go down to 8.5, 10. But on luspatercept, I pretty much stayed in the low 10s.
Wow.
Yeah, it was amazing. Actually, it was just amazing. I responded so well. And we know I am losing ground now because it's very slowly bringing my hemoglobin down. So, I'm just so thankful that I was given the opportunity to go on luspatercept. I'm just really grateful for the quality of life that it's given me. So that's all I gotta say. It's been a godsend for me.
Thanks, Donna. Our next question is, with the talk about your painful bone marrow biopsies, The question is, they'd like to know, were you ever offered anesthesia with your biopsies? Janice, you want to go first with that one?
Well, they give you a local, but they cannot go into the bone marrow. And so when they stick the needle in and it goes in the bone marrow, that's when it really hurts like crazy. I guess some people said that they were anesthetized, maybe given some sort of thing. But my doctor said, I'm a pro. I could do this in 5 minutes. And he said, you're going to hurt just for a while. But that 5 minutes was pretty bad. But, I didn't have any regular anesthesia or anything like that.
Thanks, Janice. Tim?
Yeah, for mine, I guess stupidly assumed when I went in that I was going to get that amnesia drug you get when you get a colonoscopy. I can't remember the name of it, but that was not the case. I got an IV with some happy juice in it that, it just kind of made you a little goofy, but I don't think it did the pain at all. But next time I do this again, I'm gonna push as hard as I can to get that amnesia drug. I don't see why the hell not. It just probably costs extra to have an anesthesiologist in there.
Are you talking about propofol?
Yeah, that's it.
I was not even offered that because my doctor said he was
either.
so proficient. He said,
Yeah,
not a problem. He said, I've done 1 million of these. I could do it in my sleep. And he said, you just relax. And I'm like, yeah, right.
Right.
Oh, okay. And oops, Donna, I lost you again. Sorry about that. I'm calling you back. There we go. Hang on 1 minute. Oh, there you go. Were you ever offered?
Yeah, I was not offered anything but the lidocaine, and I asked why I could not be put out. And I was told that there are more issues with anesthetic than not an anesthetic. So they are not proponents for giving you any anesthetic. Not happening. And
I apologize.
it is the most barbaric test I have ever in my life had. And I've had plenty of them. These hurt.
Thanks, Donna. So our next question is, what advice do you have for newly diagnosed MDS patients? Janice, I'll let you go first.
I think it's very important to have the NGS, the next generation sequencing to determine which type of MDS you have, because that will determine your treatment. Obviously, as you could see from our experiences, just the three of us, certain drugs work well for certain types. And so for my type with the 5Q, they put me on Revlimid, lenalidomide, and that worked really great for 10 months. And other people have said they lasted like 5 years or 7 years, but it stopped working with me for, just 10 months. But I would say make sure that you get a bone marrow biopsy. I know it really stinks, but you need to know which type of MDS you have. It's very important.
Thanks, Janice. Donna, we'll let you go next.
I would say to all MDS patients, when you're diagnosed, first and foremost, don't lose hope. There is help. They are making strides in the medication and the research, so don't lose hope. Find the right doc that you can actually have a dialogue with. As Tim and I both ended up with the wrong docs the first time. Then we found docs that absolutely not talk down to you, but have a conversation with you. That is so important. Research, 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 and write as many questions down as possible. I firmly believe the more you understand this disease, the easier it's going to be on you, because you're going to understand what comes next. You're going to have that conversation with your doc. You're going to be looking at different trial studies, different drugs, and your doc's going to know it. And if you really feel you need a second opinion, go. Ignore whatever blocks that the current doctor puts up, because my initial doc was not happy when I went up to Dr. Sekaras. Very unhappy. Well, he was the pro. Why wouldn't you go to the pro? I mean, it didn't make sense. So he gave me so much hope that first meeting. I was devastated when I walked into his office, coming out of his office. I had hope. And with hope, you're able to actually put one foot in front of the other and plan a life, because you still can have a life with MDS. So have hope and make sure that you are so thankful and grateful for every person on your medical team and your support team.
Thanks, Donna. Tim, how about you? What advice would you have for the newly diagnosed patients?
Well, following Donna, it's sort of ditto. I mean, push and find the best doctor you can find available, and push them to give you the time to sit down and really understand it, and then just read as much as you can about the disease. And I will add a plug for you, Lee. I would join this organization and the support groups. I dial in on multiple, because I always learn something new that doctor's never going to give me time as they roll in on roller skates and roll back out. So that would be my advice.
Thanks. Thank you, all three of you, for sharing your time and sharing your stories and your experiences to be able to help other patients and families. So thank you very much for sharing of yourselves today. And if you'd like to watch this webinar again at a later time, it will be available on the online platform within the next hour. And it will also be available on our website next week. I would say probably more towards the end of the week, for you to be able to watch again. If you have any additional questions, you can contact us and we'll do our best to get you the answers that you need. And I'd like to thank you for joining us, making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your families, as we've done for the past 40 years. This concludes our webinar.